Good afternoon, everyone. Once again, we are live at Sakra World Hospital, Bangalore. We have with us Dr. Arjun Srivatsa, Senior Consultant and Head of Department of Neurosciences, to discuss all your queries on myths about spinal surgery. Welcome, sir.
Thank you.
Doctor, here we are here to, our viewers have some questions to you from our followers, basically on myths about spinal surgery. So, can we proceed?
Yeah, sure.
Sir, what are some common myths surrounding spinal surgery that you frequently encounter in your practice?
Very frequently, I would say.
Yeah.
Last 20 years, I've had very funny thoughts about spine surgery coming up to me. But I think the most common ones are, the first one is, does spinal surgery cause paralysis? I think all these are seen in the movies quite often. So that's the first question they ask. The lumbar disc will it cause paralysis? I'll be wheelchair bound. That's a huge myth. And even if a bad surgery is done, you'll never be paralyzed. At the most, one nerve will be affected and you would lose some sensation in one part of the foot. That's about it. So that's a huge myth. I would like to say should be dispelled completely. Second myth I often hear is that after spinal surgery, there are long recovery time and long incisions,
Yes.
which again has changed a lot because spinal surgery is now minimal invasive, small incisions. Next morning they go home, and rehabilitation is faster. So second myth dispelled. Another one which I think should be addressed is spinal surgery is only for old people. I'm sorry, it's changed completely now.
No, okay.
We have young people as young as 18 years old who require spine surgery to get them back on their feet to do normal life. So it is a big myth about this whole issue for spine surgery.
Okay. Sir, what are the advancements in spinal surgery techniques that we have made the procedure less invasive and more effective?
I think diagnosis of spine problems have, first of all, changed everything. We find them much earlier, we can treat them earlier. And if it comes to surgery, finally, we have so many options of doing endoscopic surgery, which is a very small incision. We have transforaminal surgery, which is even no incision practically. And there is a minimally invasive surgery for putting screws also very hardly upon the spine. So all this helps in making you get out of the bed faster, get home faster, and back to work faster. I think the main yardstick would be how fast you get back to work. And that is what has changed spine surgery over the last 20 years of my being in spine surgery.
So is that true that once you undergo spinal surgery, you will always need an additional surgeries in future? Is that true?
I think the thought about additional surgery is based on statistics. Yes, it does happen to about 8 to 10% of people who would require an additional surgery, not at the same level, usually a level above or level below. And that has become a propagation among people saying, no, if you do one surgery, Marathahalli, we have to keep doing surgery forever, which is not true. I have patients I've done 23 years ago and they are absolutely fine even now. So that's not true either. It's a case patient to patient basis. So many factors are involved. Calcium being low, osteoporosis, screw damages, so many other things are involved in the possibility causing resurgery at a later date.
So how do you manage the patient expectation regarding this outcome of spinal surgery and what factors contribute to success?
A very important question actually.
Yes.
I think spine surgery, the expectation of a patient is the most important. It's very difficult to make everybody happy, frankly, but you have to counsel, work with them to understand what they want to get back. A 75-year-old man wants to get back to walking. He wants to go to the bathroom without pain. Well, a 30-year-old man wants to be doing bungee jumping after surgery. So it makes a big, the yardstick is huge between the two people. But I think counseling and the newer techniques of minimizing the damage to the muscle surrounding this has helped a lot in improving the outcomes of the spine surgery.
Are there non-surgical options for not treating with the surgery, basically?
Of course, only 20% of people need surgery. 80% of people with back issues don't need surgery.
Yeah, they're scared.
Yeah, not only scared, they don't need it really. I mean, there's no requirement for surgery. 80% of people with back problems. Physiotherapy, a change in lifestyle, body modifying their food habits, stopping smoking. All this helps in reducing your chance of spine issues. So, not every spine problem needs surgery at all. The statistics around the world is 20% of people only require surgery. That too because of requirements of changing lifestyle and stuff like that.
If you can explain the risk associated with this spinal surgery and how do you work with the patients with the minimal risk to how to minimize the risk is basically.
Again, technology has helped us a lot. We have real-time monitoring of the nerves while we are operating, so we know if any nerve is being encroached upon. Okay, we stay away from that. So those have helped us outcomes better. We're able to use navigation to put in screws when you're doing spine surgery for fusions or putting screws in spine. Navigation helped us a lot. So all this is to minimize the risks of wrong placement of screws and damaging the nerves. All this has helped. Of course, other comorbidities of a patient will also decide on how well surgery is done. A person having very weak bones, the chances of the screw can come out. So all those has to be addressed also.
Depends on person.
Depending on person to person. But broadly, yes, this is how we manage these patients.
Okay. So can you address the myth that spinal surgery is only for severe cases and not suitable for milder or a chronic condition? Is that?
Okay, indication of spine surgery can be twofold. One is, of course, the need of a patient. If he's in pain, it could be a very small disc, very minor, but if he's in pain, he's stuck in bed, 3 weeks in bed, he can't go to work, I think he needs a surgery immediately. It's nothing to do with how big the disc was or how badly damage happened. So that is how we have to decide about which patient would need surgery or not require surgery. Some chronic conditions, they manage. As they're older, they manage. Don't intervene, leave them alone. They're managing. Why bother?
Yes.
So it's all about the lifestyle of a patient. What he wants to do, how far he wants to get back to work, he wants to climb Vaishno Devi. It depends on all those things. So quite simply, tailor the surgery to what he's doing, not what you're doing or what the MRI is showing. Frankly speaking, this is how I would address this issue.
So how has technology influenced for this spinal surgery, and what impact does it have patient outcome and the recovery?
It has a huge impact.
Yes.
Over the last 20 years I've been doing spine surgery, I know it has become minimal invasive and even more minimal. So there is hardly any opening done nowadays in the spine. The muscles are not open so much. The main pain is the muscle opening. That causes so much of pain. So people are worried about pain after surgery. That comes down drastically. We used to keep patients 5-6 days in bed. Now next morning they're made to walk and discharge. That's how much has changed. Technology has changed. And the use of radiation in surgery has come down thanks to all these, the robots being used for spine surgery. All this has changed spine surgery, the outcomes also. And I also have to say that because of all this, the patients agreeing for spine surgery has also improved a lot. It was earlier 10% would agree, now 70% agree with surgery. They have seen in their own families patients doing well. They realize that no, actually spine surgery is not a bad thing.
Yeah.
Okay, so in a good hands, you get good results also.
Well, thank you, sir. Thank you for your valuable insights. Thank you, viewers. Thanks for joining us. If you have any queries, please leave us a comment. Our experts will answer to you. Keep watching. Thank you.
Thank you, sir. Thank you very much.